At the beginning of the pandemic, I was watching a newscast, and one of the newscasters said to the others, "Wouldn't it be great if we all just developed a little OCD right about now?" I was fuming because this put forth a message that I was very, very disturbed with, which is developing a little bit of a serious mental health issue will have a great benefit. Well, I think nothing could be further from the truth. My name is Dr. Patrick McGrath. I'm a licensed psychologist and the chief clinical officer at NOCD. Let's talk about differentiating people who like things to be squeaky clean and people who have obsessive-compulsive disorder. When you make a statement such as a little OCD, it just perpetuates an unfortunate stereotype. One of them being that being clean and germ-free is the only way that OCD actually occurs. Now, OCD is far more than that, and believe me, there's no such thing as a little bit of OCD. When people do have OCD, those obsessions and compulsions can take over an hour of their day, and they significantly interfere in their ability to function. While today we'll be talking about contamination-based obsessive-compulsive disorder, know that this is not therapy. Hopefully what we described to you today will give you some ideas of what might be going on in your life, and if you do need some other assistance, please see the links in the description below. Does having a fear of germs mean that I have obsessive-compulsive disorder? Frankly, the answer is no. Just because you fear something doesn't mean that you have a diagnosable condition. I don't want to get sick, but I also can do things where I feel comfortable living in the world that I'm in, even knowing that there's a pandemic going on. For somebody who likes things to be squeaky clean, they'll get a cleaning product out, spray it down on their kitchen counter, and take a look at it. If it looks good and shiny and they feel confident with it, and they'll let it go. Maybe they do it one more time just to be sure. At that point, they'll likely feel very satisfied and be able to move on with their day. In OCD, you lack that confidence. There's always the what if I need to do it one more time? What if there's still a remnant of that germ there that I didn't get? And if I or someone else gets sick, I'll be responsible for that. They'll wipe it down, but then there'll be doubts in their head. Well, what if I didn't quite hit every piece of the surface? Maybe I should just do it one more time. So then they'll spray it down again, and logically we may know that it is getting clean, but emotionally we're still concerned about what if? What if it's not quite right? What if it's not enough yet? So then we do it again. And after we hit that point where we feel, okay, maybe that's enough, now there could be another doubt popping to our head. But that was a lot of chemicals we put on there. And now are there chemical residues on there? And what could those chemical residues do to other people? Now maybe I need to wash off those chemicals from that. And we start this process all over and over and over again. You're not going to achieve a point of feeling satisfied. Instead, you're going to feel driven to do more and more and feel less and less confident as you do that. And that's when you know OCD is really playing a role in your life. Let's review the cycle that OCD takes in these experiences. OCD is two parts. There's obsessions and compulsions. An obsession, an intrusive thought or image or urge that somebody experiences as being intrusive or inappropriate. It causes them a lot of distress or anxiety or guilt or disgust or shame. And any of these feelings are so uncomfortable that it drives us to want to neutralize them. That neutralization is done through a compulsion. And a compulsion can be something we see people do, a behavioral act, or it can be something they do up in their head, some kind of mental act. And when we do that compulsion, we get a little bit of relief, but it's never enough. And the cycle kind of goes again and again and again. If this sounds like something that's happening to you, where you're moving away from the sense of satisfaction of accomplishing something to the dread of even having to do it, keep listening because we're going to talk about how you could get some help for obsessive-compulsive disorder. To help people with obsessive-compulsive disorder, we do something called exposure and response prevention therapy, or ERP. We purposely expose people to all of the things that are in their obsessions, but we have them not do their compulsion or any other safety behavior that they would do to feel good in the moment. We want them to be uncomfortable purposely. Now, you may think, why would I want to do that? Turns out from research we know the best way to help people with OCD is to teach them that they can handle the things that they are uncomfortable about. When we allow you to do that, you learn that you can take care of things without having to do compulsions. Now, we're not going to throw you in the deep end of the pool here to teach you how to swim. We're going to stick a toe in the water and see how it feels. In an instance like this, if you typically wash the counter 15 times, I'm going to ask you to do it only 14 times. And just sit with that doubt that you have about the fact that, it really needs one more in order to be just right. My goal for you is not to be just right, because that's OCD's goal for you. I want to figure out a goal that doesn't involve what OCD wants so that you can live the life you want to live and not the life that OCD wants you to live. There are people out there who know how to treat OCD, but not all therapists are the same. You want to find someone who specializes in OCD. You want to find someone who knows how to utilize exposure and response prevention for the treatment of OCD. And you want to make sure someone has good amount of work with obsessive-compulsive disorder or anxiety disorders, or at least is under the supervision or consultation of someone who specializes in that. If you're looking for a therapist, check out the International OCD Foundation. There's a great directory on there. Or you can also check out NOCD. Downloading the NOCD app will get you to a point where you can reach out to the team and schedule a free 15-minute call with them. After that, they will set you up with a licensed and specially trained therapist who knows how to treat OCD. And in between the sessions that you do with them online, face-to-face, you'll be able to utilize therapy tools that you can use between sessions, or peer-led support groups, or even messaging that's available between you and your therapist. Our goal is that you get the help that you need. So check out the links below in the description, and also check out the information from Healthline as well too. Know this, contamination OCD doesn't have to rule your life. There is help available.